In Chicago's Humboldt Park neighborhood, residents harvest fruits and vegetables they've grown on their own. The community garden represents a much-needed oasis in an area that just 3 years ago was classified as a food desert.
The tomatoes are doing real good.
Devoid of nutritious food, filled instead with liquor stores and fast food eateries.
Reach to the ceiling.
In Lawndale, a community stays fit at a neighborhood health center. Exercise classes are ongoing and filled to capacity. In South Chicago, trained community health workers teach techniques for diabetes self-care that help prevent complications such as blindness among persons living with type 2 diabetes. In communities throughout Chicagoland, in cities across the Midwest, and in countries far from our own, collaborative research, training, and advocacy are making a difference. The impact is positive and strong, advancing the cause of health justice for underserved, at-risk minorities, and marginalized populations. While the work is performed by a broad coalition, one institution stands at the center, providing the knowledge, experience, and expertise to transform the lives of individuals, families, and communities. The Midwest Latino Health Research, Training, and Policy Center, an agent of change, a center of excellence. Founded in 1993 with a grant from the United States Department of Health and Human Services, the center is part of the Jane Addams College of Social Work at the University of Illinois at Chicago. In several ways, the center continues the pursuit of social justice led by reformer Jane Addams more than a century ago.
So what our center is doing is carrying out the legacy of social reform and social change and social intervention and activism in our own way, in our own time.
So the center basically embraces each and every aspect of what our mission is all about. It has obviously major impact across our health disparities research interests. It has a major impact in our education, and in the more important policy areas, it really is a driver, not only for UIC and our local organizations here, but really at a national level of really bringing a lot of distinction to the University of Illinois at Chicago.
Through the years, founding director Dr. Aida Giacello has maintained the center's focus and direction.
The priorities has been the same that we always wanted from day one. A strong component of research, a strong component on training, and training is not just training students, it's training community professionals, community leaders, community health workers. So it's a series, and that training in a way is critical because that's where the translation of the research also happens.
With the Diabetes Empowerment Education Program, called DEEP, community health workers and people living with diabetes are trained as educators, sharing much-needed information about diabetes, including proper diet and exercise. The center is widely considered a model organization, known for its unique approach and long-standing success in conducting participatory action research, and then leveraging data to improve public policy.
I truly believe that policy should not be a political enterprise as we see it unfortunately happening most of the time, but it should be emerging from clear scientific evidence of the problem that exists and with some sound, rational decision or solutions on how to address them.
The center is at the front lines of making sure that voices that have not been a part of deliberation and discussion at the highest levels of decision-making are a part of those decisions. That's where the center, has been very instrumental in moving forward a health justice initiative.
In and beyond academia, Dr. Giacello's achievements are well known. In 2005, she was recognized by Time magazine as one of the 25 most influential Hispanics in America. In 2010, she received the American Association of Retired Persons' prestigious Inspire Award. As a guiding force, Dr. Giacello has brought her talent, compassion, and vision to the work of the center as director and as mentor.
We're all here learning. I'm learning from you, you're learning from me.
In 2001, Elizabeth Ann Barrera came to the center for a temporary undergraduate internship and stayed on as a mentee of Dr. Giacello. She developed an interest in research and went on to earn a master's degree at the Jane Addams College of Social Work. Although she is now fully employed elsewhere, she continues to participate in the research activities of the center when she can.
I'm a school social worker, and I have to do counseling with students, and basically I have to find evidence-based therapies and to work with my students, and the research this was my foundation here, so I'm not intimidated any longer by any type of research when it comes to behavioral science and so forth.
Do you guys like to cook with your family?
Natalie Meza is a teacher, trainer, and outreach coordinator with the center. Her experience here has had a strong impact on her own career.
Working with Dr. Giacello in the center, I've sort of still been allowed to teach and learn from other teachers and grow and bring in all the other aspects that I wasn't able to in a conventional classroom. It's more about communicative ways of learning and, community building and participatory action research.
In 2007, the National Institutes of Health announced a multi-million-dollar grant for its groundbreaking Hispanic community health study, known as the Study of Latinos, or SOUL. This highly competitive award was given to academic institutions in Chicago, Miami, San Diego, and the Bronx. SOUL is the largest health-related study of U.S. Latinos ever conducted. In Chicago, the center is recruiting 4,000 participants who will then be screened and followed to track health outcomes in future years. Demonstrating positive impact, Dr. Giacello and her staff received federal funding to establish a National Center of Excellence for the Elimination of Disparities, SEED. The program targets diabetes and cardiovascular disease among Latinos and African Americans. As with most of the center's activities, SEED requires teamwork.
Everything we do is collaborative. It's important to have all of the players at the table. And one of the things that we're very committed to is making sure that we add value to the work that other organizations are doing and vice versa.
From SEED to SOUL and so many other programs of the center, the greatest results have always come from collaboration. People working together.
You develop trust, which I think AIDA's been very successful in building trust with many different organizations, not only here in Chicago, but throughout the Midwest and even nationally today. I think that's one of the lessons of success is having really excellent partnerships.
And because we are very much committed into addressing issues of the healthcare system,
the Midwest Latino Health Research, Training, and Policy Center forges on in the struggle for health justice. While the center continues to succeed, the need for financial support remains strong.
The center has had enormous success in being able to leverage their expertise, their commitment, and their productivity to gather local foundation support, state support, and federal funding. But it's never enough. These are very important and expensive types of research to be done.
And here at UIC, healthcare reform, the delivery of health services, the academic medical center, and the new agenda is like foremost and prominent in terms of who we say we are as a university.
The process is collaborative, the impact transformative and empowering. As it continues to innovate, the objectives and vision of the Midwest Latino Health Research, Training, and Policy Center are as important today as ever. Identifying health disparities and achieving health justice for individuals, families, and communities.